Hi, folks. Today is Thursday, April 9th, and what we've heard from you is that consistent communication via memo and from these videos is pretty helpful. And so we're going to keep doing that on a consistent basis, a few times a week, letting you know not just what we're thinking or what changes, but try to delve a little bit into why we're thinking certain things and why certain changes are getting made. So today what I wanted to talk about was a few things, but the first being there's kind of it seems like there are two mindsets of or perspectives from you. One is a perspective that I guess a group of people that I would say maybe aren't taking the crisis quite seriously enough and or are having a harder time adjusting to the operational challenges that we need to make, or the operational changes that we need to make because of this crisis. And so just a few facts to start. This is a very serious virus. While we have no known or suspected cases amongst our residents or our staff here at any of our communities yet, New Hampshire's case total was 19 2 weeks ago. Yesterday it stood at 788. The number of cases is doubling every 7 days. That's troubling. More troubling is that there have been 3 what they call outbreaks at New Hampshire long-term care facilities or nursing homes that have been announced in the last few days. And those 3 have led to 30 positive cases amongst residents and staff and have led to 10 deaths so far. Those 10 deaths are more than half of the deaths in the state of New Hampshire. So that's something to pay attention to. You know, we've said this all along, and you know this. Older people are the most susceptible, are the most vulnerable to this virus. The other thing that's troubling is that many of the cases presented as asymptomatic, meaning people who have no idea that they have the virus could be walking around and sharing that with others. And so there's a lot for us to address there. The best way for us to deal with the fact that someone could be asymptomatic and still be positive is social distancing, 6 feet away. The second thing is wearing a mask, and that's why you see our staff now, 100% of our staff, when they're in the buildings, will be wearing a mask, either a cloth mask that you've made, thank you sewers, or our healthcare staff wearing medical masks. So my point about folks who may be having a harder time with the social distancing or may not be taking this virus quite seriously enough, this is a crafty little virus. It is hard to pin down. The symptoms are hard to pin down. We need to do everything we can. Some of those things are not fun. Some of them impact your daily life. Many of them do. And we're doing them for a reason, and that is to keep you safe. It's not forever, but it is for now. The second group of people that I would talk about are people who are really, really frightened by this pandemic. And I guess I'd say a few things to that group, too. The first thing I would say is we've got some stuff working for us here. About 2, 3, 4 times a day, I say to our team, I hate being us right now, but I'd rather be us than anyone else. And I'll tell you why. Number one's geography. So many of you know that I grew up in New Jersey. That's why I come with this level of sass all the time. But in New Jersey, where my parents still live, the number of cases per 100,000 people is 10 to 15 times worse than it is here in New Hampshire. So in our counties, Rockingham, Stratford, and Hillsborough County, where our 3 communities are located, we have somewhere between 40 and 90 cases per 100,000 people. In New Jersey, those numbers are more like in the 800 to 1,500 per 100,000 people. So we have a couple of things going for us there. We have fewer cases per 100,000, and we have fewer absolute humans here in New Hampshire. So that's helpful. I wrote this in the memo, but when I moved here, Paul and I moved here 28 years ago. All of my friends and family were like, "Why would you move to New Hampshire? There's no people there." But it's kind of working for us right now. So number one thing that's working for us is geography. Our state does not. It's sort of at the bottom tier of where spread is, but there's still an awful lot of spread. The second thing I want you to know is we have a lot of smart and very nimble people who are running your communities, operationally, your executive directors, every day. These guys pivot like you would not believe. They can turn on a dime to do whatever it takes to keep you safe. They are thinking things through that we honestly never thought we'd think about. How do you screen staff on the way into work? How do you provide masks? How do you different communication methods? How do we deliver meals? How do we change our staffing, change our schedules? You name it, they've adjusted. And they are 100% committed to keeping the virus out of our communities. And I want you to know that every single staff person that you see walking down the hallway, the leaders in your community, the housekeepers who are cleaning and disinfecting nonstop, they're doing that to keep you safe and to keep you healthy. One of the ways that actually, speaking of housekeepers, one of the ways that would talk about the way we've pivoted. Back in the old days, like January, pre-COVID-19, we would clean our common areas once a day, clean and disinfect. In March, when this really started to take off, we moved to cleaning them 3 times a day. And then in the last week or so, as we've eliminated apartment cleanings, we've been able to clean the common areas, clean and disinfect them 4 times a day. And in addition to that, the common areas get fogged with a hospital-grade disinfectant that lasts for 36 hours every other day. So that's sort of on top of 4 times a day of cleaning and disinfecting. That's when I say we're doing everything we can to ensure that the virus does not get in, and if it does get in, it doesn't spread. That's what I mean. And that's what I mean by this team of leaders and your team of staff just doing whatever they can to keep you safe and healthy. So we have geography, we have really smart and nimble people who are willing to adjust to do what they can to help keep you safe. And the third thing I would talk about is the strength of the system. One thing I am really learning is how great it is to have a team of people who trust one another, respect one another, and can rely on one another. Because in times of crisis, that's what you need. So Penny and I were taking a walk the other day, staying 6 feet apart, and we ran into a resident here in Exeter who said to me, Justine, I wasn't really a fan of this TRWG thing, and I wasn't really a fan of this system concept when you started that. But I get it now. I understand how having more depth in your team can really help in a time of crisis. And, I hope for all of us that we never endure another global pandemic, but other crises will come. And what we have is a team of people who are committed to you, whether you live in Exeter or Durham or Manchester. They are committed to their teams, and they are committed to one another. And they are committed to keeping us a strong, vibrant, healthy community that is providing you community and peace of mind forever. That kind of strength that the system can bring, that kind of strength that some additional technical skills that we can get on the clinical side or in the procurement side or in terms of inventory or financial strength or understanding rapidly changing human resource laws that because our economy changed almost overnight. That's what having the system can do. And that allows your operational team and it allows your executive directors to focus on you and the challenges that come up every day trying to keep our communities running well. So So we have kind of two groups of people. We have people who maybe need to take this a little more seriously and really focus on 6 feet apart and really focus on not trying to find a way to get their family on campus, and people who really need to focus on understanding that some of these operational challenges may be a huge irritation, but they're temporary. And we have folks who are worried, with good right to worry, but please understand that we have a lot going for us, whether that's geography or our the intellectual capacity of our people and their ability and their willingness to adjust on the fly to make things better for you. And we have depth of system now. We have one another. We have people to turn to. We have opportunities to ask questions, and that's helping. So, I often talk about when my girls were in their late teens and they would go out, like with a boyfriend, and my response to them was always have an appropriate amount of fun. And so that's, I think, what I would say to you. Have an appropriate amount of anxiety. Treat this virus with the respect it deserves, but also understand that there's a team of people working to keep you healthy and safe and strong. And one of the ways we're doing that, in addition to additional cleanings and screenings and masking and all of that, is trying to find ways to ensure that you still have access to a lot of fun in your life that maybe you can't get now by hanging out and playing cards or hanging out and having a drink in some groups or committee meetings. And so we have this website now, rwconnects.org, and that is a product of work between our resident life, community life folks in Manchester and in Durham and in Exeter and some folks here at TRWG, putting together an ongoing and continuously updated list of fun things to do. Some of them art, some of them music, some of them cultural, some of them educational. Check it out. There's fun things there to do. There's opportunities to volunteer. And it changes all the time. Every time a good idea comes up, this group of people will put it up there and open that up to you. So two more things. People have asked, how long will these changes be in place, these operational changes? And, I wish I knew. Kim O'Keefe, who's our Durham executive director, put it in the context of 100 days. Saying like we could do anything for 100 days. How 100 days is a pretty short period of time, and I like that sort of a countdown. 100 days from now, so we're about 10 days into it. Gets us to about the end of June. And that feels far. And I sure hope that we'll be able to make some changes and lighten up some of the restrictions before then. But we do have to stay the course. There are very positive things that are happening around our country because of the social distancing. We have to stay with that. We have to stay with it long enough to have it really make the kind of impact that we need it to make and give science the chance to keep up. One of the things I say to our group all the time too is, every day that we can go home at the end of the night and have no residents who have tested positive and no staff who have tested positive, it's another day that we're given science to catch up. And whether that's through therapeutic drugs or through vaccine, whatever it may be, better treatments, giving the hospitals time to flatten the curve and allow people to be served better from a health system standpoint, all of those things help. The last thing I would say is we have a lot of staff who have been impacted by this virus, even if they haven't been impacted from a health perspective. And that's because our economy changed overnight in March. And so many folks are not able to send their kids to childcare, and so may not be able to work. Or they've had a spouse or a partner who's been laid off, and that's cutting their income in half or worse. We have established an emergency fund for our staff who have financial challenges because of this virus. We've funded the the emergency fund so far with contributions from our leadership team and from our TRWG funds. And we've started that with we have just about $30,000 in there now. And we want to give you the opportunity. Many of you have asked how you can help. This is one option. There will be a letter in your mailbox in the next day or so that just lets you know if you're interested in making contribution, you can too. We are very committed to helping our team at this time. There are people who are suffering a whole lot more than I am, and perhaps you are. And our goal is to make it as good for them as possible until we get healthy again as a country, as a world, and as an economy. So I guess what I would end with is saying, there are words. I love words. For an accountant, I have a lot of them. But there are words I never want to use again. And redeploy is one of them, because we redeploy resources here and there all the time. Words like an abundance of caution or asymptomatic is currently the word I hate the most. But there are words that I will always continue to use, and thank you is a big one. Thank you to all of you. Thank you to our resident sewers and cutters and ironers and such, making cloth masks for our staff, for our health center residents, and eventually for you all. That matters. And wearing a cloth mask may not protect may not protect me from you, but it protects you from me. And if we're all in that habit, which our staff team now, 100% of our staff will be masked when they're in the buildings, it's just another layer of protection. So thank you to our sewers. Thank you to all of you who have been, just about as nimble and as patient as our staff team has, in terms of we have to make changes. Oftentimes we can't give you a lot of notice, and you're adjusting on the fly just like we are. Patience is another big word, not one of my real specialties, but one I'm learning. And commitment. Commitment is a word I'm going to keep using, because it's unlimited. Our commitment to you, to your health and safety, is unlimited. Our commitment to one another, to our team, to our system, our family of communities, to helping one another, our commitment to coming out of this on the other side and being strong and healthy and the kind of place that provides community and peace of mind. That's what we're here for. So I'll say to you, this too shall pass. I wish I knew when, but when it does, we'll be even better for this, because we will have endured something together that we didn't want to, we didn't ask for, and I'd like it to go away. But because we have, we're stronger, and we will continue to be stronger. So thank you for your patience. Thank you for your commitment to our community, and know that we feel the same for you. So wash your hands, stay 6 feet apart, and until we can meet again in person, love you.